Gram-positive bacteria are the familiar faces in veterinary bacteriology. Gram-negative bacteria are the ones that tend to generate the most critical patients. That outer membrane we talked about in our cell structure talk, with its LPS, its permeability barrier, its serological diversity, is both a weapon and a survival adaptation. In this talk, we're going to meet the key gram-negative players in veterinary medicine and understand them through the lens of what they do, where they do it, and why those features matter at the bedside. One of the most common mistakes is equating gram-negative with gut infections. Yes, many important enteric pathogens are gram-negative, but this group spans every body system. Your BRD pneumonia in a feedlot steer is caused by Mannheimia hemolyticum, gram-negative. Your abortion storm in a cattle herd might be Brucella abortus, gram-negative. Your dog in septic shock from a pyometra is shedding E. coli, gram-negative. The one common thread is that outer membrane. Regardless of where the infection is, if it's a gram-negative organism, you have to respect the potential for endotoxemia. Genius of E. coli as a pathogen is its plasticity. The chromosome of a harmless commensal E. coli in a dog's gut might be 95% identical to a strain causing fatal neonatal septicemia in a calf. The difference is a handful of virulence genes, often carried on mobile genetic elements that can transfer between strains. The ETEX strains that cause scouring in neonatal calves and piglets are carrying genes for specific fimbriae to adhere to the gut, plus toxin genes that hijack the enterocyte's cyclic AMP system, flooding the lumen with fluid. That's why the calf scours without blood. It's not a destructive infection, it's a toxin effect. Treatment is fluid replacement to replace what's lost, not necessarily antibiotics alone. Salmonella is what we call a facultative intracellular pathogen. It can survive inside macrophages, which allow it to do something most bacteria cannot: use the immune system's own transport network to spread throughout the body. The type 3 secretion system is essentially a molecular syringe that Salmonella injects into the host cell to trigger its own uptake. It tricks the epithelial cell into engulfing it. Once inside macrophages, it resides in a modified vacuole called the Salmonella-containing vacuole, altering the cell's normal killing machinery. This intracellular lifestyle is why Salmonella infections can persist for weeks and why treatment is complicated. Your antibiotic has to penetrate the macrophage to reach the organism. The critical concept with Mannheimia hemolyticum. The bacterium is already there, living in the nasopharynx of most healthy cattle. Transport stress, weaning stress, commingling with new animals, all of these spike cortisol and suppress mucociliary clearance and neutrophil function. The organism seizes the opportunity and proliferates rapidly, then aspirates into the lung. Once there, its leukotoxin specifically targets and destroys bovine leukocytes, the very cells that should clear it. The resulting lung inflammation is so intense that the lesions are grossly visible within 24 to 48 hours. Bright red consolidation with a fibrinous pleuritis, and LPS from the dying bacteria amplifies the systemic inflammatory response. Metaphylaxis protocols treating whole pens at arrival exist precisely because we understand this pathogenesis. Brucella is one of those pathogens that should give every veterinarian pause. It's a serious zoonosis and a real occupational hazard. The reason it causes abortion rather than other clinical signs comes down to a biochemical quirk. Erythritol is a metabolite found in high concentrations in bovine fetal fluids and the placenta. Brucella preferentially metabolizes erythritol and uses it as a growth signal, which is why it localizes and proliferates in trophoblasts, causing the necrotizing placentitis that results in abortion. This is elegant and somewhat terrifying evolutionary biology. The organisms are shed in enormous numbers in aborted material, placental fluids, and milk, all of which represent exposure risks. Gloves, masks, and eye protection when handling abortions are mandatory, not optional. One big concept from this talk: gram-negative does not mean gut infection, and gram-negative does not mean the disease will look the same in every animal. What it does mean every single time is that there is an outer membrane with LPS, and that LPS is a trigger for catastrophic inflammation if it enters the bloodstream in large quantities. Your gram-negative patients are the ones most likely to crash, and they're often the ones where the bacteria are the least of the problem once sepsis sets in. The LPS is already in the bloodstream. Treat the patient, not just the bug. Read the case question, think about it, we'll then work through it together. This is a pathogenesis question that directly answers a treatment question. ETEG causes disease not by invading and destroying the intestinal mucosa, but by secreting heat labile LT and heat stable ST enterotoxins. These toxins activate adenylate or guanylate cyclase in enterocytes, elevating cAMP or cGMP, which drives chloride secretion and inhibits sodium glucose absorption. The result is a massive outpouring of isotonic fluid into the lumen. The calf is literally losing its circulating volume out the back end. The mucosa is largely intact. This means the primary threat is dehydration, hypovolemia, and the resulting metabolic acidosis from poor perfusion, not bacterial invasion. Replace the fluid and correct the acidosis, and most of these calves survive. Antibiotics are secondary. They reduce bacterial numbers and toxin production, but they do not address the immediate physiological crisis. Vaccination against M. hemolytica is an important part of BRD prevention, but it isn't a complete solution, and understanding why requires integrating the host, agent, and environment. Vaccines primarily induce antibodies against the leukotoxin and some surface antigens, which reduces severity and mortality, but they don't eliminate colonization of the nasopharynx, and they don't prevent the stress-driven bloom of organisms. Vaccine efficacy also depends on timing. A calf stressed from transport with suppressed immunity may not mount an adequate immune response to vaccination at processing. The most important interventions work on the host: stress reduction, adequate rest time, good nutrition, and the environment, reducing commingling, improving ventilation, appropriate stocking density. The vaccine is one layer of a multi-layered prevention program. No vaccine works in a vacuum of poor management. Read the case, think about it, we'll then work through it together. The answer lies in the microbiology of the aborted material, combined with the zoonotic risk. When Brucella abortus causes placentitis and abortion, the organism replicates to enormous numbers in the trophoblast and fetal fluids. We're talking billions of organisms per gram of placental tissue. The infective dose for humans is extremely low, potentially as few as 10 to 100 organisms via mucous membrane exposure. Exposure routes include skin contact with contaminated fluids through microscopic cuts or abrasions, aerosolization of fluids, particularly during delivery assistance, and splashing of fluid to mucosae. You cannot confirm Brucella before culture results, which take days. So the PPE goes on before you touch the material, not after you get the diagnosis. Brucellosis in humans is a serious, debilitating infection causing indolent fever, arthritis, and complications that can persist for months to years. The occupational risk is real, and the prevention is simple.